pregnant and she doesn't even start shopping. No, no. Most women start shopping after 6 months, first month, although some start shopping. Pregnancy that has gone beyond 3 months, you are sure that okay, this pregnancy will likely stay to the end, that everything is fine. So that's why we say that most first trimester pregnancies will progress to second trimester. But there are certain pregnancies that may have some challenges during the first trimester, what we call miscarriages. You have a bit of bleeding, not so much, a bit of abdominal cramps. But those pregnancies, they all go on to do well and go and very severe abdominal cramps and vaginal bleeding that is severe. It's oftentimes indicative of a miscarriage. All right, a miscarriage. Blighted ovum means that a woman is pregnant, but there's no baby inside the womb. There is a gestational sac, but there's no baby inside. It does happen. Okay, that's what we call like anembryonic gestation. All right, and then you have what we call a missed abortion, where the woman is not bleeding, baby is inside, but baby is not alive. The heartbeat has stopped. All right, and then you have what we call an incomplete abortion, when the woman bled, had pains, but not everything came out. For all these categories of patients, an evacuation will be needed to evacuate the uterus. And the first 3 months of pregnancy, you want to be very careful about what you take, the medications you use, and what we strongly advise is that women should avoid medications as much as possible and only use medications that have been prescribed by your doctor. All right? Prescribed by your doctor. So for women who get pregnant spontaneously, all that you need is just folic acid, iron. But folic acid, you have started taking it like 3 months before you even got pregnant. Development. And then you go on to now start taking iron that's contained in your pregnant care. And then you add your anti-malaria afterwards. And then that is all. Because for those who get pregnant through IVF, there are other hormonal medications that we will add to your medications, which you will take in the first trimester, the first 3 months. And after that, you will stop. All right? If for any reason you are sick and we need to administer medication, we must ensure that it's a medication that is safe. For those who are hypertensive, who are on antihypertensive, we must make sure that the antihypertensive you are taking is what is safe. You may be taking an antihypertensive while before pregnancy, but once you are pregnant, you need to change. If you got pregnant through IVF, while you are going through the process, we need to know what you're taking, and if it's not safe, we will change it. Same also if you're diabetic and you're on medication, we need to know what you're taking. If it's not safe, we'll change. If you have these seizures, epilepsy, there are women that have these seizures and they are on medications. There are women who have thyroid disease conditions and they are on medications. Whatever medication you're taking, we need to. All right? So next is nutrition. Very, very important. It's important for you to ensure that you maintain a normal balanced diet. You know, a lot of patients say, doctor, I'm not eating the way I thought I would. You know, when I got pregnant, I thought, I was supposed to eat. Like I said before, it's different. Why some women will eat heaven and earth, some will be running from food. You understand? All right? So it differs. What you like, what you don't like, what you can tolerate, what you don't tolerate differs from one patient to the other. So what we often will say is that just follow what your body is saying. But what is important is that you must ensure that you eat balanced. Your diet is balanced. A lot of fruits, vegetables, water, carbs, protein. It is the hormone. All right. So it's something that is to be expected because these things will change. All right. So there are a lot of craving eating kwabi, all those local Eastern delicacies, those things that you need to use potash for. Please, for now, while you're pregnant, in that early stage, you avoid it. Avoid spicy food because of the heartburn and the discomfort it will give to your stomach. All right? As the pregnancy advances, your appetite will change. All right, for those who were not eating before. Now, if you're having hyperemesis gravidarum and you're having all of those symptoms of pregnancy, your appetite will improve, and then you discover that you start eating well. Some people may lose weight during that first trimester, particularly if it was so bad and second trimester and then third trimester. All right. So for other tips, get and then make sure you for those who are on luteal support program, make sure you take your luteal support. And then once you are done with the luteal support, for those who got pregnant through IVF, register for your antenatal care. All right. And after the luteal support, many of you may need to have what we call a cervical cycle. I do have what we call a cervical cycle at the end of that first 3 months. That first most of our patients who got pregnant through IVF. Why? Because of the way you pleasant IVF. Why? Because of the way you pleasant situation. Say that she has had about 1 or 2 miscarriages before, and they were very early miscarriages, about 6 weeks, 8 weeks. And those early miscarriages are as a result of abnormalities. So if it just opened and she lost the pregnancy. So in my mind, I told myself, I wish I knew. That's why we're not gods. I wish I knew that this woman, but this kind of condition, I would have applied a cervical sacrilege. But she's going to get pregnant again. That's the good news. And when she gets pregnant, we'll have to put a sacrilege, all right, to when she get pregnant.